Over to you, Dr. Chetan. Please enlighten us.
Organizing committee, scientific committee, our respected panelists, and ISM6 for providing this platform. My topic of presentation today is learning M6 the Help Me See way. Financial disclosures, I'm a consultant with Help Me See and work there as a subject matter expert and chief instructor. So for those of us who are not aware about Help Me See, it's a non-profit organization based out of the US, and its mission is focused at eliminating preventable blindness from cataract worldwide, the incidence of which is currently 100 million. And we do this by offering simulation-based training in ophthalmic surgeries. So the picture that you see here is of Albert Ucci. He is founder of Help Me See, and he was also a co-founder of Orbis International. We all know that Flying Eye Hospital from Orbis International was a big success, but it had its own limitation, and it was not possible to scale up the efforts that we were putting in eradication of cataract blindness. So he came up with this novel idea of creating the Help Me See simulator. Okay, so this is the picture of the Help Me See eye surgery simulator. It's the only simulator in the world which simulates the M6 procedure, and it's the only simulator which has tactile feedback, and it's the simulator where we can use for performing the incisions. And let's play this video. I think there's something wrong with the slides. So as you can see here, the tunnel construction step is being performed. We have the crescent in the right hand and the colibri forceps in the left hand. And as you perform the scleral groove, you can actually feel the resistance that the sclera offers and the resistance that we feel while dissecting the sclera and the cornea. While we are doing this, a trainee might go superficial and create a buttonhole, or might go deep and end up in a premature entry. So all these complications are simulated on the Help Me See simulator. You can see how intricately the graying of the cornea can be seen. It's quite close to how we see it in the real surgery. Steps like making the paracentesis injection and paracentesis and injecting viscoelastic and capsulorhexis, all the steps can be performed on the Help Me See eye surgery simulator. So this is the list of the advantages that simulation-based training offers, and out of the list I would just like to highlight a couple of them. Like it allows repeated practice, and thereby we can safely train all the trainees in all the steps of SICS. It can help us learn from our mistakes, so the trainees can really understand how they are tilting the blade, how fast they are cutting, and what is causing them the complications. We can also objectively measure the performance parameters, so we can measure the length of the tunnel, we can measure the depth, how deep the dissection was. So we need evidence to support that what we are doing is helping, and these are all the studies. There are a lot of studies which have proven the benefit of simulation-based training, but the studies that you see here, they are based on the Help Me See eye surgery simulator. So we have enough evidence to show that training on the simulator does help in the live surgeries. But more than this, it is the feedback that we get from the trainees and from their mentors about how the trainees have improved post the training. That is the incentive that keeps us going. So how is Help Me See training different from traditional training? First of all, it's a proficiency-based training. We have a structured program. We perform objective assessments on the simulator, and it is also an instructor-led program. So by proficiency-based training, we mean that we train each trainee until the trainee demonstrates proficiency. So they have to do repeated practice, and we review their performance parameters. We can objectively measure how they are performing on the simulator. And after each session, we do a debriefing with the trainees to know what they have learned and what difficulties they faced. We also do the grading, and we use training tools and guidelines. So you might have seen in the video there were some green lines telling us how much they should dissect and where should be the location of the paracentesis and things like that. So we offer 1-day or 4-day courses. Currently we have SICS training, we have FACO training. All these are 4-day courses, whereas we also have a short 1-day courses where we train in complications management. I'm going to show the list of courses that we cover in the next slides. But as I said, we have a very detailed schedule, and what the trainee does on day 1 and day 2 is already planned. So on day 1, they would normally start with making the paracentesis, injecting viscoelastic, and creating the tunnel. On day 2, they would perform capsular excis hydrodissection. On day 3, we train them how to deliver the nucleus out, and on day 4, they just learn the simple steps of IOL injection and hydrating the paracentesis. We also have good e-learning modules which prepare the trainees before they land up at the simulation training center. And as I said, at the end of the training, we do assess the trainees how they are how well they are working on the simulator. So we make them do 5 attempts, and out of those 5 attempts, they have to show at least 3 satisfactory attempts. And the training tools and guidelines that we have used during the training, we don't allow them to use those training tools. And the pass criteria, as I said, is 3 out of 5 satisfactory attempts. So it is instructor-led. We always have ophthalmologists around to guide the trainee and to correct their mistakes. These are the pictures from our Mumbai training center. We have multiple simulators there, around 7 to 8 simulators, and sometimes we have batches of 8 residents attending the training, and we train all of them. As I said, a trained ophthalmologist is always around to guide through the simulation-based training. There was a time when we were also doing remote training. Now this is a picture from D.Y. Patil Medical College, and this is during the COVID times. You will see all the residents are in their mask, and we did not want the surgical training of these residents to take a hit, because during COVID times the opportunity for surgical training was very less. So during those times we did what we call as the remote training. So the trainers were sitting in Mumbai, but the training was happening on the simulators in Pune. So it was very helpful for the trainees to learn in a safe environment without compromising patient safety, and we could continue with some of the surgical training during COVID. So this is the list of the surgical procedures that we have on the Help Me See simulator. As I said, it's the only simulator which simulates SICS. It is the only simulator which has suturing on it, and it is the only simulator with tactile feedback, wherein you can feel the different tissue dissection, the resistance offered by the tissue. We also have vitrectomy now, recently added, both anterior and pars plana vitrectomy. In these courses, we train the surgeons on inserting the trocar and cannula, performing pars plana vitrectomy using an automated vitrectomy cutter. And we also have a phacoemulsification course which has the foot pedal, just like how we have in the real life. So there are multiple components of the training. We have the e-learning, we have classroom sessions, we have debriefing sessions, and of course we have the simulator sessions. This is the picture that the trainer gets to see. So this is collected from 4 different simulators, and at any given point of time we can monitor all the 4 simulators. I just want to show the different centers that we have across the globe. This is a center in Germany, in France, in Strasbourg, where we have trained 4 doctors who are now training on the simulator. We have also partnered with LV Prasad, where we have 2 simulators, and we have a well-established training center. This is a picture from Arvind. We can see Dr. Shankar Anandan here, who is our lead instructor, and we have conducted a lot of camps as well. Recently, we started a new center at AIOS headquarters. We inaugurated this center a couple of months back, and we have placed 2 simulators there, and a lot of training is happening there. Every week we get around 6 to 8 trainees who want to learn on the simulators. This is our another partner, Shankar Eye Hospital, Bengaluru, where again we have 2 simulators. We have set up a sim lab, and a lot of training is happening at this center as well. Another center at Shankar Netra Chikitsalaya, Eluru, Vijayawada. So to summarize, simulation-based training is a game changer. It's an innovation with great potential, improves patient safety, and shortens the learning curve of the trainees. So may have a role in certifications of surgical skills going forward. Thank you all for your kind attention.